We have with us Carolyn Duvar and Rebecca Martin Fraser, and we will be hearing now about the National Healthcare Language Program from our lovely partners here at ISANS. Go ahead, please.
Thank you. Welcome, everyone. Thanks for having us. This is a program that we started this year, or last spring, I guess. So it's been just over a year. It's a program that we delivered in Nova Scotia first for many years. I've been teaching for many years. I've had many lovely students. And we have just gone national as of last March, so 1 year before that. So we're able to deliver our programs across the country, except for Quebec. So that's been quite exciting. And we've had students from everywhere, I think, except up north. I don't think we've had any students up north yet. Lots from Ontario, though. So it's been quite exciting. We have instructors across the country as well. We have partners. Rebecca will go over the partners that we have. And we have simulations that we've done across the country as well. So we'll talk a little bit about that as well. Okay, so as Carolyn said, we've been offering sector-specific language courses for internationally educated professionals for many years at ISANS, and then we've recently gone national with our National Healthcare Language Program. So specifically, we've expanded 3 of our healthcare programs to the national level, which are the communication strategies for patient interactions. And this one is for pharmacists and physicians. We've expanded the professional communication skills for nurses and also our strategies for CELBAN. So that's a specific course that's training for the CELBAN exam. So the Canadian English Language Benchmark Assessment for nurses. So these courses have been reviewed by medical professionals and are ensuring their accuracy and authenticity to meet those communication needs for the internationally educated healthcare professionals that we're serving. And so in going national, we've partnered with 4 organizations across the country to deliver the program. So our partners in Ontario are the Catholic Centre for Immigrants and the World Skills Employment Centre. In the Prairies, we have Calgary Catholic Immigration Services. And in BC, we have ISS of BC's Language and Career College. So of course, ISANS is working with the IEHPs in Atlantic Canada. So between all of us, we are able to offer these courses and programs to many of the provinces minus Quebec, and therefore give the opportunity for different time zones, which has been really great for our clients because you're all very busy. And so with that being an opportunity, a lot of people are opting to take those courses at different time zones that they might not be living in. So if you're in BC and you're working and you have children and you need a course that's at a different time than what's offered in BC, you can just sign up for the Halifax course and take it at a different time. So that has provided a lot of flexibility for our participants as well. So this is our program structure, a little quick overview of our general structure. The classes are 100% online. So they're either synchronous, so they've got a couple of online meetings per week. That's specific to the course that we do with the physicians and the pharmacists, or they're asynchronous, so they don't require any online meetings, and those are all of our nursing courses at the moment. So they're between 8 and 16 weeks long, depending on which one you're taking, and always facilitated by qualified instructors. And there will be ongoing enrollment across the country at any given time. So basically, we've set it up so that it's as accessible as possible. And the cohorts for the physician and the pharmacist course are basically running every month at the moment. And the nursing courses are, you can enter one of those any Monday. So if you are eligible and you are interested, you can sign up and go through all the eligibility process and sign up and start any Monday that you like if you are in the nursing programs. So we'll look at eligibility. So in terms of eligibility status, you must be a candidate that is currently residing in Canada with permanent resident status, or you've arrived in Canada as a convention refugee. Hold a valid work permit with the MOME 23 annotation. You could be a participant in the Atlantic Immigration Program or the rural, it used to be the Rural Community Immigration Pilot. So now I think that is called the Rural and Northern Immigration Pilot, or the Rural Community.
I think it's rural.
Yes,
community.
Rural Community, my mistake. Or protected persons under the Section 95 of the IRPR. Presently, we are unable to take pre-arrival clients or citizens just due to our funding. Okay, so that's our eligibility for the program. So I'm going to pass it over to Carolyn, and she's going to tell you a little bit more in detail about the specific courses we have.
Great. Communication strategies for patient interactions. So this is our course for international medical graduates and international pharmacy graduates to help them with the OSCE. So it's one of the examinations they would like to pass and pass with high scores. We have designed the course based on the OSCE communication competencies that they need to demonstrate in the exam. And it's focused on patient communication because that's what the exam is focused on. And also it's 8 weeks long. So there's work that you need to do online. And then we have 2 synchronous classes per week, usually in the evenings, but because we have different partners, it can be at different times. And it's every month. So we have a cohort every month now. And the minimum Canadian language benchmark, that's a language assessment that the language schools in Canada use. You have to have at least 6 in all skills, so listening, speaking, reading, and writing. But I'm the program lead, and I would accept a 5 in writing because the course is not writing based, so we can have some flexibility. But we've tried with lower scores in the other skills, and the course is too difficult. There's a lot of reading and a lot of homework. At the end, we have my favorite part, which is the communication practice session with simulated patients. So I'll go over that a little bit in a bit, but that's where we practice everything we've learned in the course. So the course covers basically the interaction with a patient in the OSCEs, and the OSCEs is also simulating real life. So it works for all of that. So we start with building rapport. So in the OSCE, that's walking in the room, washing your hands, introducing yourself, and then on to conducting patient consultations, which is basically doing histories, doing it in a way that patients expect in Canada and in the OSCEs, and using the questions that get you answers faster. Understanding patients' concerns, so it's showing your ability to ask for clarifications, accept clarifications, or paraphrasing. Showing empathy, which is very important in life, but very important in the OSCEs. So the way that you're expected to show empathy, the phrases that you use and the techniques. Offering advice, not telling them what to do. So that's a change for some of our students. They're used to being the person that just tells the patient what to do. We have to help you get the right words for gently guiding them towards doing the right thing. Ethics and patient recovery is always interesting. Ethics is always interesting, especially if we do, say, a birth control case or something for teenagers. Breaking bad news and dealing with angry patients were something that our students specifically asked for. I think it's probably the hardest part of most OSCEs because it's a lot of communication skills. For the pharmacists, we break out breaking bad news to more of a reading and summarizing skill because they don't actually have to break bad news in their OSCE, but they also have to do a lot of skimming and scanning of materials and I believe a summary of an article. So we just kind of break them out for that one class. So this is my favorite part. We started this off at Dalhousie. This is actually at Dal. So Dalhousie University helped us set up a communication practice sessions. So it was really important to have authentic exam experience, but it's only on communication skills. It's not an OSCE simulation. It's a communication simulation. So we have simulated patients trained by Dalhousie. Dalhousie helped us design the cases. We have cases for doctors and pharmacists and for Nova Scotia dentists as well, but nationally we don't take dentists. So they go through in the simulation of an OSCE. They're going room to room and they're practicing the cases, but they're doing it in pairs. So they get peer feedback, and then they also get feedback from the simulated patient, which they love. It's video recording, which is always amazing and horrifying because you have to watch yourself, but you also get feedback. You can remember everything you did or how you looked. You know, some people might not sit in an appropriate way. And then at the end, we have a debriefing session. And it also gives people an idea of what it's like if they've never done an OSCE. So that works well. Next slide. Oh, and I forgot to mention, we're doing this online now because it's national. So online, we're doing it with University of Toronto simulated patients and University of Calgary simulated patients. So the exact same setup, it just is online so we can reach all of our students. So the next one's for nurses, professional communication skills for nurses, our international educated nurses. And this one is for the workplace. It's not exam-based. We found some nurses were coming in quite quickly with the new language requirements and maybe getting to work and realizing they need maybe not language skills, but communication skills and the confidence in the skills that they might already have or help with some changes in some of their skills. So this is focused on speaking and listening. It's 8 weeks of asynchronous, where the doctor and pharmacist course is 8 to 10 hours per week. This one is 4 to 6 because the nurses told us they wanted a shorter course. And it's a lower CLB minimum. Very similar to the other course that I just talked about, starting the patient interaction, doing the histories, understanding what the patients are saying, you know, what slang they're using, how to figure that out, showing empathy, giving instructions and advice, educating the patients, ending patient interactions, and then we added exchanging information. So the nurses, you know, changing shifts or talking with someone else on the healthcare team or to the doctors. Strategies for CELBAN. So this is the Canadian English Language Benchmark Assessment for Nurses. It's skills-based. This course is a higher level than the last one, and it takes a little bit more time. And it has improvement strategies to help pass a language proficiency exam. We kind of compared it to the OET, and it's similar. So it's a similar approach to the exam. So this one is compatible. We've been recommending it for that as well. It's divided into 4 modules: listening, speaking, reading, and writing. You can take them simultaneously if you have a lot of time, or you can take them one at a time or 2. Listening and speaking and reading, you need CLB 7+, and writing, you need CLB 6. So these are all asynchronous. The previous one was asynchronous as well. The nurses couldn't make synchronous classes. They're all working shift work. So they can join any Monday. And then we've had the doctors and pharmacists ask if they could join these as well. Because they're healthcare based, there's an assessment at the end of all these courses. They get to practice an online assessment. They get feedback from the instructors. So a lot of the doctors and pharmacists seem to be interested in writing. I think it might be related to IELTS. So you get individual attention with an instructor and feedback on the reports.
We mentioned earlier that the nursing courses, they were blended, they were in person at one point or another, and we put them all asynchronously because they didn't have time and they couldn't meet that need for the attendance requirement. So as requested, we shifted them to all online asynchronous courses, but they were then missing that piece of practice. So they were not able to do that role play practice that they had when they had the sessions online or the in-person sessions. So we were able to incorporate AI to solve this issue. So our challenge was just replacing those in-class role plays and practice. And our solution was the AI avatars that we're using for role play practice now, and for the assignments that they have to submit to receive feedback. We were lucky enough to find a Canadian company called CyberPatient. So they're based out of Vancouver, and they are an innovative virtual hospital platform. Quite amazing, really. So they've got over 130 interactive patient cases. It allows them to do that theoretical knowledge in a realistic, safe environment. So they can make all the mistakes and do it over and over again and feel confident by the time they get out of there, where they can do it in real life and not worry as much. So, and go into those exams not worrying as much. So just future healthcare professionals building confidence to kind of step out into that real world practice. So this is just giving you an idea of what it looks like. I'm not going to do a demo, we don't have time, but They start out with a structured history taking. So you'll see they've got their avatar on the right side. They've got a very structured approach to the initial assessment of history taking. So they go through, patient information, chief complaint, history of illness, etc. And they go through a bank of questions that they can choose from. There's about 150 questions in the bank, so they do have to prioritize because they only get to ask 30 questions. So based on that patient case, they need to decide which ones to prioritize and use to get at the end result fastest. So after immediately doing those cases, they get immediate feedback from the platform. And it kind of breaks it all down into, their percentage score on their knowledge and their time spent, etc. And it also tells them, out of the questions they've asked, which ones were required, which ones were relevant, which ones were irrelevant. So it gives them an idea of how they did in terms of that. And then the actual facilitator of the course will give them feedback in addition to this based on their communication skills. The next one they would move to from that structured practice is the AI freeform communication practice. So this is where they also get 30 questions, but they're making them up on their own. So this is coming from their own skills they've learned in the course and life, and they're just wording them in their own language. And the virtual patient responds, and they get to have that interaction with them. And based on what they've been doing, but not out of the bank. It's very free form. And so they also get immediate feedback from that one as well. So it gives you the conversation. So the transcripts on the left of the conversation that actually took place. So they can actually go back and see, oh, this is what I said and this is what they answered. Okay, and this is the feedback I'm receiving on how that went. So they go with positives, they go with areas of improvement, and then scrolling down or past that, it was more specific feedback to areas of improvement. So they get a lot of feedback out of it from that platform. And then again, the actual facilitator will give them specific communication feedback as well on top of that. So it's been really great. It's it's a pilot, as we say. And so far so good, but it's proving to be a good option for replacing that in-person lack of having that role play practice. So they're really enjoying it so far, and we're hoping that we can continue the partnership. So if you're interested in registering, you can go directly online and register yourself, or you can contact Olga or Lucy at the healthcare language at ISANS.ca. That's and they can help you if you're not sure if you're eligible or not. So they can go through it with you and then register it for you. So that's our program QR code, and we really appreciate you having your conference here today. So thanks.